Well, welcome everyone. Thank you for joining us today. We're really excited to have Dr. Megan with us. So Megan is a qualified chiropractor. She has a Bachelor of Applied Science in Complementary Medicine. She is also a certified NET practitioner. So we're really excited to have her on the call today, and we're going to be talking about the topic of NET and how this, method can be used to help manage stress and emotional blocks in people's lives. And so, Megan, do you want to just tell us a little bit about yourself and how you got involved in NET?
Sure. So I qualified as a chiropractor back in 2008. So I've been practicing for over 10 years. And chiropractic philosophy does talk a lot about the different stresses that can impact our body, but we mainly focus on the structure being, the spine and nervous system. And we do discuss emotional stress can also affect, and nutritional stress and chemical stress as well. But they never really gave us that tool as to how to address those components. They really only gave us the structural components. So I started seeing actually a kinesiologist not long after I graduated, there is overlaps of kinesiology and kinesiology is functional muscle testing to find where there's imbalances in the body. And I went to see a kinesiologist because I was experiencing gut health issues. And she sort of explained to me that actually, this is more an emotional or stress trigger rather than it being a food allergy thing or a physical ailment in that sense. So it really opened my eyes to this idea that the mind and body is just so strongly connected, and I just really needed to find a way how I could utilize that component into my practice and help my patients, especially when I find that maybe my clients were coming back with the same physical ailment over and over, and the treatment was just more a band-aid approach as opposed to really getting to the core of the problem. So we talk about those 4 bases of health in NET or neuro-emotional technique, being the structural, the emotional, the stress, the toxins, and then the biochemistry and the nutrition. So NET is really focusing on that stress and emotional component to whether we have physical ailments, but also it affects, it's working on actually where there's suppressed or blocked stresses in our body. So unresolved stress patterns, basically. So it can work in various ways in terms of mind entry or body entry, and we can work to see if there's a stress component to a physical ailment, like I said, gut issues or back pain or allergies, or when there's sort of something chronic hanging around. But we can also check to see if there's any subconscious belief systems that could be holding us back from being well and healing, or even just day-to-day things like, I've got this goal I want to reach, and for whatever reason I just can never seem to get there. Right. And we can see if there's a subconscious block that's holding us back from achieving what we want to achieve. So personally, NET has changed my life. I've received the treatment ever since I started practicing NET, which I've been practicing NET since 2011. So that's going on, 8 years now. And then it's just totally transformed my practice and my clients as well. So that's a little bit about me and how I got into it.
Okay, wow. And so when I came to see you recently, you had a chart up on the wall. Can you talk a little bit about that diagram? Might be helpful for me to, after the call, or email you a few resources and links. But sure. The best picture I could find is that the one you mean? Yeah, that's it.
Bases. Yeah, so this is one of my folders for learning NET. Hopefully it comes up, but that's where we were talking about the different bases of health. So NET was developed in America by American chiropractors, the Walkers. And so we have actually got a baseball pitch here that they describe it as. So we've got the different bases of health. So we've got the structural component, the emotional stress component, toxins, and then the nutrition. So really we need to be addressing all of these areas in order to achieve wellness. Mm-hmm. If we're missing a piece of the puzzle, so if I'm just addressing as a chiropractor the structural component of someone's ailment, but the trigger is actually stress, then as I said before, this might just be a band-aid approach. Right. So we really need to be looking at all areas holistically to be able to get to the bottom of someone's problem.
Okay, great. And so what sort of things can NET be used for?
Mm-hmm. So as I mentioned before, various things. I mean, sometimes people wouldn't think to see a chiropractor for, I guess, stress problems. But, I mean, as we know, stress is basically an epidemic these days. So Sometimes, it's a simple thing such as, you might notice that we've all got our weak spots in our body, I think. So, for example, I have clients with just, as I said, chronic neck pain, or it might be a gut health issue for me. My weak spot's gut health. And when I do feel stress or when I notice my gut playing up, I have to start to pay attention. Okay, what's going on? Stress-wise or emotional-wise, that could be triggering this. So it can be helping any physical ailments to see if are those stress triggers. But where I really find it interesting is also to help with the emotional or the mind component. So as I said before, it's actually working on things such as, false belief systems, self-sabotage, even things like phobias, past trauma that we can't seem to move on from, chronic health elements, as I mentioned, but even things like goal achievement. So a question I like to ask clients is, what's not true in your life that you'd like to be true? And it could be, I'd like a relationship. I'd like to be pain-free. I'd like to earn X amount of dollars a week or a year. And, we don't realize, but the subconscious is actually driving 95% of what we do. So sometimes we can actually have these blocks or these sabotages going on without realizing it. And using the functional muscle testing through NET, we can actually narrow down what is the block, what's the emotion, where did it actually start, what's holding you back. And it could be as early as childhood, and even going back to sometimes we take on our parents' belief systems as well, or generational belief systems, and we take them on unknowingly. And then that becomes sort of a story we start to play out, even though we don't want to play out that story. So that's where it's really fascinating to see rationally and consciously you want to believe something, but there's something deeper down that's held you back. And as I said, these things can develop from really early on. So it's a way to identify those things and clear them out, because sometimes we don't know what we don't know.
Exactly. Wow. Yeah. And so if somebody's got like an illness, serious illness, maybe cancer or something else, would you think it would be a good idea for them to do some NET sessions? And if so, like, why would you say it would be a good idea or important?
So we all experience stress in our life and various degrees of trauma as well. And, even the birth experience can actually be traumatic. So we can actually experience these sorts of stresses from day dot. And a lot of the time we process those, they come in, we process them, they leave, and they no longer bother us. But sometimes we don't have the chance to process these stresses in a healthy way. And so they can they manifest and they store somewhere. And we believe that it stores in the body. And NET takes branches of Chinese medicine. So we use the principles of using the organ meridians. And that belief is that all different organs hold different emotions. So, for example, the liver holds anger and resentment and frustration. So if we're holding on to a lot of built up anger or resentment towards someone or a situation or something happened to us a long time ago, that can start to cause maybe a problem in that liver meridian. So, yes, in that component, it's possible that, I'm not saying that stress is the only trigger towards, say, cancer, but no doubt that cancer can be causing stress to a person as well. And actually, I know you might actually ask me about the research that's been done.
Yes.
About NET, and that was for the research that has been done with this technique has been around cancer patients. So it's actually the traumatic event that they experienced by receiving that cancer diagnosis. And what they did was take an MRI of the brain, and we could see how the parahippocampus lit up on the brain. This might not show up clearly, but I'll email the info through. It lit up on the brain before any NET treatment. And after about 4 to 5 sessions of NET, when they rethought of that traumatic experience, it no longer lit up on the brain in the MRI. So we've now got that evidence, and that's been published. So it's actually, I have had a few cancer patients come through, and it's even just the fears that they may be experiencing, the fear of death, the fear of pain, the fear of operations, and the negativity that's around it as well, and the scare tactics and the scare, the fear that can be instilled in them through the medical system. Of course, we need the medical system, absolutely. But it's also, the stress will just aggravate inflammation and problems within the body. So any way we can take the edge off the physiology of that stress in the body, hopefully will allow the space for better healing.
Yeah, fantastic. Great. And so I was going to ask this question. In your personal opinion, how much of someone's health issues are emotional based? Like if you had to put a percentage component, how much would you say is based on the emotional component?
As I said before, I think there's those 4 components to health that will all be contributing at various times. How much of it emotional? I think it's on the higher percentage, really, because even if we're thinking of something as simple as chronic headaches, it's not a simple thing, but when you get the headache, yes, there can be many structural reasons for that or physical reasons for that, but the stress that headache is causing. So I would almost go to say close to 100% will have some sort of emotional stress component to people's health ailments. But, of course, people have to also be open to that idea. Some people don't want to acknowledge that they're stressed, and that's okay. It's all when they're ready, and that's when we find that the technique can work most effectively.
Right, when somebody's open. Fantastic.
Yeah.
And so how does it actually work? Can you actually explain for people watching the method? Because I know that when we spoke, there was 2 ways that you could do it. So can you talk through those?
Yeah. So we've got 2 ways which we can sort of, I guess, enter the body to be able to discover if there is stress going on. So we've got the mind entry way or body entry. So body entry, where we could actually touch an area of the body, a shoulder issue, a neck issue, and we use functional muscle testing. So as I mentioned before, I usually use the arm test. What we're looking for is not actually necessarily a strength test, but it's actually almost like a reflex, like our knee-jerk reflex. We're looking for a lock and unlock of the muscle. So quite often what can happen if there's a stress component to, and say a neck issue, we will muscle test and we will see it unlock. And we're looking for changes in the muscle test. So the muscle test isn't actually used as a yes or a no or a true or a false. It's actually checking for, we're just checking for change. So then we see the emotional points are on the forehead. So we cross-check it to the emotional points. And if that changes the muscle test, that's indicating to me as a practitioner that there is a stress component to a physical ailment. And then the muscle test actually does respond to semantics, so the words that I say. So we start to narrow down options of, okay, what could this stress be? What we're actually talking to is, as I said, the subconscious part of the brain, and we're working on this idea of emotional reality. And what that means is whatever is testing up with regards to the stress is actually not true or fact. It's perception. So we perceive, the way I perceive the world is different to the way you perceive the world, and we could experience the same thing and we both perceive it differently. So, we can have an argument with our spouse and then all of a sudden the perception is they no longer love me and they're going to abandon me. And that's not the truth, but we perceive it and the brain runs with that belief system. So that's what we're trying to narrow down with the NET process through the muscle testing. We then scan the body to find which organ meridian is holding the emotion or the stress. As I mentioned before, different organ meridians hold different emotions. So that could come up through the kidney point, which are more fear-based emotions. And then sometimes we'll clear the stress on that level, on the present issue, like fear that I'm going to be fired at work. Okay. So the fear that you're going to be, kicked out of your workplace. And then sometimes we can go back to, okay, where did this stress first begin? So if we sort of get it to a more generalized approach, it's, okay, the fear that I'm going to be, as I said, kicked out or isolated or alone. So that could be back to, as I said, 4 years old, when no one wanted to play with you at kinder. And that's why we're actually having the physiological response of a 4-year-old as opposed to, a 30 or 40-year-old where we want to think rationally. So the thing is, sometimes we notice we actually overreact to a situation and we're not sure why. Chances are it's triggering something old. So there's the body entry component. Then there's the mind entry component. So sometimes I can just simply get a patient or client to think of a stressful situation that they're in, or a person that causes them a lot of stress. It could be a family member, it could be work, it could be relationship with your partner, or work pressures like achieving a certain income goal. And even just thinking of the situation with muscle testing can bring up, we'll see a change in the muscle test if that is causing a stress or physiology change in the body. And then we narrow it down again, as I said, through finding the organ meridian, finding the emotion, and where did that stress first start. The other way we can do the mind entry is actually checking to see if you're congruent with a statement. So that's where I used the question before, like, what is it that's not true that you'd like to be true in your life? And people say, I'd like to be in a relationship. So we could actually test the statement, I'm okay being in a relationship. And if there is a stress or a block with that, again, the muscle will unlock. And we can find, okay, why would it serve you to not be in a relationship? Oh, I'd lose independence. I'd lose, I could be hurt. So there's all these actually subconscious or reasons why we might be holding ourselves back from achieving what we want. So that's the mind entry component. And that's, as I said, we'd either clear it on the present issue, or sometimes we go back to the original event of where it first started. The idea is if you clear the original pattern or the event, it sort of clears all the future patterning around it as well.
Okay, wow. That's great. And so what can people sort of expect after having an NET session, or even, one or multiple? So what would be the difference of having one versus a series? And
depending on what you're coming in for, if we're doing more body, working on the body and the stress component to the body, hopefully you might even notice a little bit of pain relief or freer movement within that area of the body. But most of my clients describe after the first session feeling a little lighter, especially if we've been working on something that's been holding a bit of pressure or stress on their mind for a little while. Sometimes people feel quite emotional during the technique as well. And that's encouraged, because when you're clearing the stresses, the better you feel the emotion, the better it will actually leave the body. So you might feel a little tired or drained or a little bit emotional afterwards, as well as common. But most of my patients describe feeling lighter, and like when they do think of that particular stress or their body issue, it's actually not as strong or noticeable as it was when they first walked in the door.
Okay, fantastic. And so what sort of issues can people resolve with NET? Like, if somebody has had that particular issue, when would you say to them probably a good idea to, talk to someone?
Well, as I said, I think most clients could benefit from, working with this stress component in this technique, because I think we all are exposed to stress to varying degrees. We've probably all got different ways we adapt to it, and our resilience can vary, but we all are experiencing it. As I said, usually clients come to me usually knowing about the technique, like yourself. They may have heard about it, or they may have had a friend tell them about it. But if someone's just never heard of it at all, where I might introduce it to them is if they're, again, from a chiropractic perspective, if they're having an issue with their body that's, keeps recurring, and I sort of introduce that concept of, okay, maybe we need to look outside the box a little bit and look at these other bases of health. And this is one way we can do it through NET. I have various clients or various reasons why people might see me, from people who are in quite a depressed or stressed or anxious state and really struggling with the day-to-day, to entrepreneur types that are already thriving quite well and just want to keep hitting the next level and removing any blocks that are stopping them from hitting the next level again and again. So it's really various scales, and everybody's journey is different. I have clients that come in just when they're feeling they're going through a bit of a tough time. I have clients that come in just like almost as maintenance, wanting to work through stuff before it becomes a big problem, and all the in-between. So anyone could benefit from it, but it's also about finding the right practitioner for you and the person you resonate with. And look, there's not, I guess, one technique for everything. So there's various ways in which you can work through the stress or emotional component. Kinesiology is another modality. There's people may have heard of EFT or emotional freedom technique. There's hypnotherapy. There's NLP. So there's various ways that are working on this subconscious mind. It's just about finding the right fit for you.
Okay, great. And can someone do NET to themselves? Like after they've seen you, is it then something they can do for themselves?
Not exactly the full protocol, but we can give tools for you to be able to, again, take the edge off and work through any sort of other layers that might pop up between sessions. So there is, we've got a tool, and I'll send you the instructions for this because anybody can use it, even if you haven't seen me or a practitioner before, of just a breathing technique that will help, take the edge off emotions. And that's when you're just holding your pulse points on your wrist, hand on the forehead, and just breathing through any stress or feeling that you're experiencing at the time. Then you swap to the other side, holding the wrist again with all 3 pulse points, and the same thing again. So that's probably the closest you can get to doing NET on yourself. However, it's not something that, I mean, if I wish I could do NET on myself, but I think the whole importance is not to have bias. And I think if you were to do it on yourself, you may sort of influence your testing or,
right,
because it is out there that you can self-muscle test. I think that, you know, that's things you can look up on YouTube, and there's practitioners that will teach that. But I think for the best results, it's best to have a practitioner guide you through it.
Yeah. Okay, great. And is there science backing NET? I know we're doing this interview now, and I am going to show the preview to people before they watch the interview. So can you just talk a little bit about the science backing the method?
Yeah, absolutely. So there is we've got a foundation called the One Research Foundation, which is all privately funded by NET practitioners, by patients around the world. And the biggest research that has just come out recently was what I mentioned before with the MRIs and how we can actually see the changes in the brain pre and post treatment with NET. And they're also now gaining further research that's now published research, and that's available, and I can send through extra information with the images for you as well. But they're now trying to gain further information on from that research paper to build on more. I believe the next one is actually they're going to look a lot into lower back pain and the NET approach with that. So that will be great because the first research has been done by psychologists, actually, who practice. A lot more psychologists practice NET in the States compared to here, which is brilliant, and it's starting to come over here more and more. So we wanted to bring in more a physical, I think the NET wanted to bring in a more physical or body worker approach to the research, which is where the lower back pain research will be coming through. So, yeah, there's a brilliant documentary that's come out now as well, which is discussing the research in more detail.
Fantastic. And I guess the final question I wanted to ask you, actually it's the second last. So why is doing this sort of work really important, I guess, to you and just generally?
I think, as I mentioned before, just stress is just such an epidemic now. I think people are looking outside the box for other solutions, especially when they're getting frustrated with various systems and not quite getting the results that they're wanting. And I think the sooner we can get on top of our negative or false belief systems, the better, and we can start to thrive in life, and life can become a little easier. But also, we're not aiming to. We can't remove stress. It's not going to happen in that way. But it's about building up resilience, so we're better able to adapt when things do come our way. And what we don't realise is when we do have these belief systems running, we actually, what you think, you create. So we can actually subconsciously be manifesting more problems or manifesting more, more difficulties unnecessarily in our life. So I listened to an interesting podcast the other day where they were talking about, sometimes we adopt these different identities. Like, I'm the fixer. I fix everybody's problems, and I'm the problem solver. And if we identify with that, what can happen is you'll start to create problems for the sake of fixing them.
Right.
Which, doesn't always have to be the case. We don't want to have that become our identity. We want to be able to help and support people, but without creating unnecessary problems and attracting that in. So I think it's groundbreaking, NET, and I think it's so exciting that we're now coming through with more and more research for that as well, and it's becoming more known within Australia. We're teaching more seminars here, and it's been featured, as I mentioned in the documentary, it's actually been featured on the TV show Grey's Anatomy as well, which is really exciting. So it just needs to be shared more and more. That's what I feel.
Fantastic. Well, I am so pleased that you could do the interview today. I'm very appreciative of you taking the time. Could you just share with the people, our viewers watching, how they could get in touch with you if they want to, utilise your services or find out more information?
Sure. Well, there's a few resources I can definitely refer on to. The documentary is called Stressed. You can, I think it might still be available on YouTube for free, but otherwise the links, I think you're going to share that, as you said.
Yeah.
There's also my website can be found. It's just my name, .com.au. So it's meganazer.com.au. I practice in Camberwell in Melbourne and also in the city on some days as well in the CBD. There's the NET website, which you can log on or access that, and there will be, I think in the top right-hand corner, there's actually a practitioner finder button, so you can search on there if there's a practitioner near you. There's a few of us certified practitioners in Melbourne, all scattered around. And on my website, as well as the NET website, is also what's called the Wellness Check questionnaire. So I highly encourage everybody to check that out and complete it, just to see, you know, where your health's at and where your stress is at. It actually gives a really good gauge on what's going on for you and how stress may be playing out in your body. And you'll see it will color code your scores, and anything sort of in the red zone definitely needs attention. So that's something that's really helpful to me as a practitioner if you want to bring that along, and just also great for your own interest. Yeah. That's
great. Well, awesome. I really appreciate it once again, and thank you for joining us today. And
having me.
Great. And I'm sure everyone got a lot of value out of watching this.
Thanks
again.
Ta.
Thank you.
If people can get the vision of a planet where people know how to de-stress, only then can we have a world that's actually safe and peaceful to live in.
If you can address a person's stress in their life, I feel like that should be number one.
When somebody's under a lot of stress, at least emotional stress, a whole cascade of things can be going on, from neck problems to low back problems to stomach problems to anxiety.
But if we can get to what is the underlying cause that keeps getting re-triggered, lives can change.
You can have all the positive affirmations you want and intend for different things to happen, and that's all cognitive. That's all your brain talking. But this was distinctly different in that it was in my gut that I felt different.
I'm a brain imaging guy. I'm not a psychiatrist, and so seeing the changes to me were among the more dramatic that I've ever seen with regard to any kind of intervention, any kind of medical or psychological type of therapy for people.
It just wasn't there anymore for most of those patients. In fact, everybody had some response where there was far less to no activation.
I think the consciousness of people in general is real open that maybe I have something to do with my health condition.
Stress is a fact of life, and healing can be a fact of life.